My name is Susan Cera. I'm a colorectal surgeon at Physicians Regional Medical Center in Naples, Florida. Here at Physicians Regional, we are very concerned about the virus and keeping it under control. We've taken extra precautions in the office, including everyone wears masks, and we've set up dividers between the patients and the secretaries and the patients and the nurses. In addition, we take extra great care in cleaning the rooms, cleaning all the touchable surfaces, and of course we're also offering some telemedicine visits on those types of visits that can be done through telemedicine. If there's anything obviously that would involve a visual examination or palpation, then that would be something that would require an office visit. It's very important not to delay care, especially during the pandemic, if there are symptoms that can be concerning, including abdominal pain, rectal bleeding, bloating, nausea, vomiting, constipation, and diarrhea if it's lasting longer than 2 weeks. So these would all be symptoms that would be considered concerning, and the things we're concerned about are infection and cancer. Obviously, there are other things that are not related to these problems that can cause symptoms. However, it's very important to rule those things out because those can become life-threatening situations. One of the most common questions that I hear from patients is that they have rectal bleeding, and it may have just occurred one time without any pain. And the question they have for me is that normal? And my response is always, rectal bleeding is never normal. And as a matter of fact, it's one of those things that you should not put off seeing a physician for because it can indicate a very serious condition. Sometimes the rectal bleeding is from benign things such as hemorrhoids. However, more concerning would be that it's from either a polyp or, heaven forbid, a cancer, which when you delay that kind of diagnosis can result in some life-threatening problems. One of the things we do when someone presents with rectal bleeding is obviously to do a physical examination, and if there is something that appears to be causing the bleeding that's found, it may just require something as simple as adding fiber to the diet. However, if it looks a little bit more ominous, we may need to proceed with a colonoscopy to determine the actual etiology of the bleeding and therefore the treatment. Until we know what is causing the bleeding, we can't very well tell until we identify where the source is coming from. I'm going to talk a little bit about the new technology and procedures that we have for colon and rectal cancer. These days, obviously, there's a big push for cutting-edge treatments, which we do offer here, and they're all considered what we call minimally invasive procedures, meaning we make very small incisions or maybe no incisions at all to be able to intervene surgically to either remove or ameliorate some sort of either neoplasia, which is abnormal growth in the colon or the rectum. Here at Physicians Regional, we have 2 robots that we use pretty frequently for all types of colon and rectal disease processes. The robot offers faster return to recovery, and because there are less incisions, there's less pain. In addition, with cancer, it allows a patient to be able to start their chemotherapy earlier since the recovery is quicker. And for people who work, it allows them to get back to work faster and get back to their regular daily life. There's also a second procedure here that we call transanal minimally invasive surgery. And what that involves is laparoscopic procedure using the anus as a natural gateway into the intestinal tract, and we can do surgical procedures without making any incisions in the abdominal wall. Again, it offers much quicker return to recovery, and in those particular situations, very minimal pain. Most of the time, people stay in the hospital maybe one night, they go home the next day. And this is a procedure that takes a lot of specialty training that have undergone here at this hospital. and it's not offered at very many places in the United States. So it's one of the very special things that we're able to offer our patients here in terms of minimally invasive procedures. I also want to talk a little bit about the Cologuard test and how we feel as a GI group about that testing. I think it's wonderful testing. It tests for abnormal cells and blood in the stool. The American Cancer Society recommends that if you've had bleeding within the past year of having a colonoscopy, you should still have another colonoscopy. That's why it's very important to detect for blood and obviously for abnormal cells. The only issue with the Cologuard is that it doesn't replace a colonoscopy, and the reason is that a Cologuard is very good at detecting when a person already has cancer. It's not very good at detecting things that may be the precursor to the cancer. A colonoscopy actually identifies polyps, which are precursors to cancer. And at the time of colonoscopy, we can remove those polyps and therefore prevent a patient from getting colon cancer. Colon cancer is the second biggest killer in the United States of cancer, caused by cancer. However, it is also the most preventative cancer to have. So by having a colonoscopy, you can actually prevent having colon cancer. A Cologuard is still used even if you're getting colonoscopies. The American Cancer Society recommends that if you don't have any risk factors for colon cancer, you get the Cologuard every 3 years and a colonoscopy every 10 years. Now obviously that schedule is determined by your family history, your symptoms, and your risk factors, and all of those would be reviewed by your GI specialist. Another common thing that I see patients for here in the office is hemorrhoids. And I caution people that if they are having hemorrhoidal symptoms, it's very important to see a physician as soon as possible. I think one of the most dangerous things that patients can do is to self-medicate at home for long periods of time. I don't have a problem with people doing preparation H for a couple days. However, if the symptoms don't improve, it's very important to see the doctor right away. The reason being is 75% of my patients who see me for hemorrhoids don't have hemorrhoids. They have other types of problems. And I've made this calculation based on days and days and days worth of information of people seeing me. And most of the time, these patients don't have hemorrhoids. They have other types of perianal diseases, which again can become life-threatening if not addressed in an urgent manner. Those things being infections, obviously cancers, and a lot of times painful things that start out very benign, but then become very painful and can become more urgent and even require surgery if not addressed soon enough. One of the most common things that I hear people talk about is how to determine if what they're feeling is actually a hemorrhoid or not. And it's very difficult because obviously that area is difficult to self-examine. I have a lot of patients trying to take pictures or have maybe a significant other take a look. But ultimately what you see may not always be what's actually going on. So it's very difficult to be able to self-medicate and self-diagnose or even go on Google. And a lot of times when people do have hemorrhoids, and I can explain to you what a hemorrhoid looks like and feels like, a lot of times that's often not the issue that's driving their symptoms. Everybody has hemorrhoids. Everybody's born with hemorrhoids. Hemorrhoids are natural venous anal cushions that keep the anus closed when we're not thinking about it, when we're at rest, and we don't have to worry about things. However, hemorrhoids become what we call pathologic or symptomatic, usually 4 different ways: either constipation with lots of straining, diarrhea where the actual number or frequency of bowel movements causes the hemorrhoids to be pushed out, having babies because the intra-abdominal pressure that's caused and results in hemorrhoids, or lifting heavy things. People who are power lifters or even movers who move a lot of furniture tend to have hemorrhoids, and that's the reason. However, a lot of times people do have hemorrhoids, but that's not the underlying cause of whatever symptom they're having, whether it's an infection, whether it's a cancer, whether it's anal warts. But a lot of these things, whether or not they need surgery or not, need to be intervened in order to be adequately treated and resolved. If you do have any of these symptoms, pain, bleeding, or any abnormality that's not the typical, especially if it lasts longer than a couple of days, it's very important to either see your primary care physician or a GI specialist to be checked out right away. I think Physicians Regional Medical Center is a great place to be established for GI conditions. The reasons being we have very cutting edge technology and treatment options. In addition to a very large GI specialist surgical department, we have very highly trained physicians of all specialties, including a hepatobiliary surgeon, 2 colorectal surgeons, and GIs that do very specialized and advanced procedures.